Hey everybody, what's going on? So, got something that you guys have requested a lot, so hang tight real quick. So, lots of people asking me about skull stuff because if y'all follow me, you know I like doing skull work. A lot of people requested mandible. Like, sir, how do we do a mandible? Whenever there's a mandible x-ray, we hope there's a student so they can do it for us. So, I'm gonna do my best today. I don't have the most cooperative patient. It's just, stuff happens. So at the moment, I don't have any people to use, so I'm gonna use a skeleton. Not ideal for what I would like to do, but let's see if it works. So mainly I'm gonna look at the axiolateral oblique or the axiolateral mandible. So this we're looking at side of interest, which normally we're gonna do both sides. So I have my patient with their head placed in as close to a true lateral as I could get it. I have a 25 degree cephalad angle on my tube. So the amount of angle is gonna kind of depend. So we want no more than 25 degrees. So that could be a combination of angle on our tube and tilt on our patient. This patient, I can't tilt his head. Normally, I would want to tilt the head towards the image receptor a little bit, maybe tilt it 10 degrees, and then I would use 15-degree angle on my x-ray tube. So combination of those two, not to exceed 25 degrees. So you can have your patient like this with the IPL perpendicular to the image receptor, mid-coronal plane parallel to the image receptor. Mid-coronal perpendicular, mid-sagittal parallel, and then your nice big angle. So what we're doing in this case, we are looking at the patient's left side of the mandible here. So with this angle, we're coming up under this mandible, hitting the affected side. You can also rotate the patient's head slightly. So if you rotate the head 10 degrees towards the image receptor, you're going to get a good survey of the general mandible. If you leave the head perpendicular without any rotation, you're going to get a good image of the ramus of the mandible. So I like to do the 10-degree rotation towards the image receptor. That gets the body of the mandible up against it better, gets it more parallel to the IR, and then we're able to get a good survey of that entire side of the mandible. So what we're trying to do with the angle is get, in this case, the patient's left side of the mandible good without superimposing over the right side. And then when we do the opposite side, we do the same thing. We would just turn the patient the other way, keep our angle, depending on the patient. So sometimes you don't need to do that tilt. If your patient has really long neck, low shoulders, they're able to depress them a lot, you're able to get in there. Patients, in my experience, that have a smaller neck, y'all know I like to use the guy from 90 Day Fiance, No Neck Ed, as I call him, as the absolute worst patient we could x-ray as far as anything with the head and neck goes. I don't even know how I would get his x-rays, I'm being honest with you. But for the most part, I like to tilt the head a little bit and then apply a little bit less of an angle. So it just depends on your patient body habitus, but remember, 25 degrees. 25 degrees is the most we want in total. Remember, that's a combination of tube angle and how much the patient's head is tilted. Again, rotate about 10 degrees towards the image receptor, take a good survey of the entire mandible, leave it perpendicular, no rotation, to get a good image of the ramus. So that's the mandible without having a real patient. I hope that helps some of y'all a little bit who are struggling with this one. Leave me some comments, leave me some questions if you got them, and I'll see y'all next time. Y'all have a great day.